Okay, so today I'm going to finish the rest of the lectures from the thyroid and parathyroid. And today I will cover the parathyroid gland. And parathyroid gland, this is an endocrine gland, parathyroid gland, and among the 6 major endocrine glands, parathyroid gland is one of them. And parathyroid pathology is also not very common, but it can confuse is it a parathyroid or thyroid, because the thyroid gland and parathyroid glands are very close. And not only close, parathyroid gland rests on the thyroid gland. And when there is a pathology, unless there is a pathology, we don't see the parathyroid gland. But when there is a pathology, we need to know how does it look like, what is the sonographic appearance and characteristics, how I'm going to describe it, and what would be the effect of enlargement of the parathyroid gland on the thyroid gland. If there is a mass in the thyroid gland, a parathyroid gland, how it going to push the thyroid gland, and I will say, oh, this is not the mass in the thyroid gland, but it is in the parathyroid gland. Okay, let's explore the parathyroid gland. Okay, parathyroid gland, we'll go first about the anatomy. So, in anatomy, we need to know that how many, there's numbers. Number 4 parathyroid gland, and location. It is a posteromedial aspect of the thyroid gland. And because of this posteromedial, and easily we can see the posterior part of the thyroid gland. So then it is very helpful to understand that this is a parathyroid gland. And commonly 2 pairs. Superior and inferior. Okay, 2 pairs. But in one thyroid gland, one thyroid gland, there is 1 pair. So there are 2 thyroid glands, so there are 2 pairs. One is superior, another is inferior. They are behind the middle third and lower third of thyroid gland. And cannot be found anterior and retroesternal. anterior or retroesternal. Okay, that means thyroid gland, if we in sagittal view, if we consider the upper third, middle third and lower third, the parathyroid gland is behind the middle third and the lower third. Okay, so and cannot be found anterior or retroesternal. And size. Should not exceed 5 millimeter. That means it could be equal or less than 5 millimeter. 5 millimeter means half a centimeter. Okay, now shape. Shape is flattened and oval. Okay, so now let me explain with the drawings that where are they located in anatomically and how we're going to see it. You done it? Good. So just understand that in sagittal, in normal anatomy, draw the thyroid gland. Okay, if this is our thyroid gland, and we know that this is isthmus, and this is right lobe, and this is left lobe. If we consider that this is the sas, and draw an imaginary line from the isthmus, so that would be the width. So this is length and this is width. This is length and this is width. And now if we consider that this is 3 division, this is upper 1/3, this is middle 1/3, and this is lower 1/3. So then where is it located? It is posterior and anterior. That means it will be located, one is here, another is here. One is here. Okay, let me divide it into 3. One is here, another is here. That means parathyroid gland does not locate with the upper 1/3. So this is upper parathyroid gland, this is lower, means inferior parathyroid gland. As it is posterior and medial side. So this is midline. How do I know this is midline? Because the trachea is here. Trachea is in midline structures. So these are trachea. So now can I say yes, parathyroid gland is posterior of the thyroid gland and medial to the thyroid gland, and one with the upper lobe, one with the lower, one with the middle 1/3, another with the lower 1/3. So now my question, this parathyroid gland is separated from the thyroid gland. It is not within the thyroid gland. That's why when the parathyroid gland, you see, you have to keep that, usually it is not seen, but when you see, you have to keep that in mind, the parathyroid gland is enlarging. Then we have to find it out what could be the cause of the parathyroid gland enlargement. Most common cause is a benign tumor. Parathyroid gland, benign tumor. So, and let me just give you a little idea. Parathyroid gland is endocrine gland, right? If you see the parathyroid gland is enlarged, then you have to look for main disease. MEN, multiple endocrine neoplasia. Main 1 and main 2. So this main 1 and main 2 actually involves 4 different types of endocrine neoplasia. Once you see the pathology in the thyroid gland, you have to look for pathology of the parathyroid gland. If you get the pathology of the parathyroid gland, you have to look for tumor or pathology in the islets of Langerhans in the pancreas. Then you need to look for the pathology in the pituitary gland. You need to look for pathology in the adrenal gland. Okay, so this is a beautiful connection. That let me give you the idea that why there's a multiple endocrine gland are affected in one time. And multiple endocrine gland neoplasia is not a good disease. And we know the endocrine glands are producing hormones, right? And hormones are essential for the body. Now, why there is a multiple endocrine gland are affected at the same time? We have to understand a basic concept that in our body there is more chance to have disease than no disease. It is a miracle. It is a miracle that why still we are alive. Why? Because there are so many exogenous factors and endogenous factors that can cause disease in our body. Then you can ask, then why it is not happening? Why not everybody is dying from cancer? You got my point? Now, come to this point. Our body has cancer suppressing gene. Cancer suppressing gene. What is cancer suppressing gene means? Gene means where the gene lives in the chromosome, right? In the DNA, there's a genetic properties are written, and also the sequence of gene are there. Some of the genes are responsible for cancer suppressing gene. Let me give you the BRCA1, that's a breast cancer suppressing gene 1 and 2. So these are the suppressor gene, means they suppress the cancer from developing. And if there is a mutation, you know what is mutation? Of this suppressor gene, then what gonna happen? They cannot perform their suppression effect. As a result, what happened? Multiple pathology. Example, if some person is going to a correction department, right? And if the correction department itself is corrupted, so then how they gonna correct you? Okay, suppressor genes is like that. When they are mutated, that means they are not in functions. They cannot, and all cancer related genes will be excited and body will get the pathology. So now I will show you sonographically that where you can see this pathology. As I am in the anatomic position, anatomy, so let me show you that this is your image sonographically. This is a sagittal view of the thyroid gland. So in sagittal view, says thyroid. In sagittal view, what are the orientation? Anterior, posterior, superior and inferior. So there is no medial and lateral here. There is no, in this orientation, it is a SAS view. But we can scan the medial and lateral of the thyroid gland by moving the transducer medially and laterally. And in this view, sagittal view, there is no right, there is no left. So now in order to get the right and left, we have to get the transverse thyroid. When you get the transverse thyroid, you're going to get this kind of view. So then it will be anterior, posterior, that would be right and that would be left. So understand that parathyroid gland is posteromedial. Can I say this is anterior part, this is posterior part? Yeah, okay. And imagine there is a 3 part of the thyroid gland. So you should get one thyroid gland posterior here and one thyroid gland is here. In SAS and in transverse view, look, this is the medial side, this is medial. And this is, why medial? Because the trachea is here. Trachea. And this is posterior. And our parathyroid gland is posteromedial. One is here, another is here. Right? Question, where do I need to check the parathyroid gland? This is a big challenge. People doesn't get the parathyroid gland, but because they don't know where is it located in SAS view and in transverse. So now these are parathyroid. Parathyroid. Now questions. As it is not within the thyroid gland, when it is enlarged, how does it look like? And where it going to happen? So now, can I say, if this parathyroid gland is getting enlarged and it has a capsule, it is separated from the thyroid gland. So, how the thyroid gland will be affected? Thyroid gland will be pushed anteriorly. Write down. When the parathyroid gland is enlarged, thyroid gland will be pushed anteriorly. You can say laterally. So when there is a parathyroid gland enlargement, you will see so it is better understand with the anatomy. That's why I discussed over here. So these are parathyroid gland when it is enlarged. So thyroid gland will be pushed anteriorly. And here, if this parathyroid gland is enlarged, so thyroid gland would be pushed this way, anteriorly. Sometimes you will see there is only one. Only one is enlarged. Let me show you this picture. When there is a one parathyroid gland, then you might see parathyroid gland enlarged. See, this is parathyroid. And you will see something but which is not parathyroid gland. This is esophagus. If you see at the same time there is a parathyroid gland enlargement and there is the esophagus, you have to know the esophagus is seen with the left thyroid lobe. And parathyroid gland, you can, if it is on the right side, then you will see like that. If it is happening on the left side, then you will see the left lobe of the parathyroid thyroid gland is more pushed anteriorly. As it is not within the thyroid gland, so thyroid gland is not enlarging. Who is enlarging? Parathyroid gland. Then we're going to learn how does it look like. Okay? So anatomically, we are understanding that where you can see the parathyroid gland. This is very, very important. So now we will discuss about the physiology. So now we're going to discuss about the physiology of the parathyroid gland. Physiology. They produce parathyroid hormone. Okay, some book says its name is Parathyroid hormone. They monitor the calcium of the body. Number 3. They have the critical role in metabolism and regulation. They have critical role in metabolism and regulation of calcium by producing parathyroid hormone. They are controlled by negative feedback mechanism. Okay, the name of the hormone is parathyroid hormone or parathormone. We usually call it PTH. They monitor the calcium of the body. That we need to understand what is calcium. Where are they located in our body? Is calcium a valuable and one of the vital mineral in the body? Yes. So now, calcium is the ingredient of the bones. Calcium. Bones, cartilage, teeth. During the pregnancy time, a mom is producing a fetus and fetus is turning into full-term baby and the fetus has bones in the body. The weight of the bone in our body is a major factor of the